Hello, welcome everybody. I'm Liana Lianov, the president and founder of the Global Positive Health Institute, and this is the GPHI's podcast series on positive psychology, healthy lifestyles, and all things related to health and well-being and happiness. And today I'm delighted to have with us a longtime colleague and friend, Dr. Rich Safir. We go way back with the American College of Preventive Medicine and the American College of Lifestyle Medicine, like-minded about so many things. And his official job is as Chief Medical Director of Employee Health and Wellbeing at Johns Hopkins Medicine. So welcome, Rich.
Thank you, Liana. It's so nice to see you, and thank you for the reminder that we really did meet at an ACPM meeting.
Yes, it's been a while, and
Yeah,
then also, I also remember the health promotion meetings as well.
yeah. It's kind of crazy how time creeps by.
But here we are, and we're plodding along, like-minded, and really trying to change the world through these key elements of health and well-being. So what first grabbed your attention to the importance of a healthy lifestyles, positive psychology, and all that goes into that?
Well, I was fortunate to have chosen to study nutrition in college. So I actually got my degree in nutritional biochemistry. And it wasn't just about what foods are healthy and what are not. It was everything from the cellular level all the way up to the community level. So this really expanded my idea of what it is, what's healthy and how we stay healthy or learn to be healthy. So even before going to medical school, I was already convinced that we needed to do more to keep us from getting sick than currently our society was focused on.
Yes, and clearly we still have so much to
Yes.
do in this space, although the space and interest in the space has grown. For example, the membership of the American College of Lifestyle Medicine has grown amazing in the last few years compared to when I was one of the leaders. So clearly people are starting to think about it at the health professionals and others. And so that's wonderful to see. We have a long ways to go, so share with us how you're using this in your own life and as well as professionally.
Well, in my own life, I'm fortunate I got off to a good start because as a child, we ate generally healthy and I learned my exercise habits. As an adult, stress creeped in and I've been very intentional. And the one thing that I think has been transformational for me was my mindfulness-based stress reduction retreat. And since then, I either meditate or have some type of mindfulness practice daily. And of course, my own practices as well as my education have influenced what we do at Johns Hopkins Medicine, the strategies and the resources. We're lucky to have been funded to have a full-time equivalent, one person dedicated to bringing mindfulness strategies to our institution. And that includes gratitude and appreciation, which of course goes hand in hand with happiness. So we're pretty we offer a broad variety of strategies, resources, and programs, but we're also very strategic in how we set the conditions that make it easier for our employees to be happy and healthy throughout the day.
Yeah, it's both, like you say, what we can do, and our attitude and what we focus on, but our environment makes a huge difference, of course. So it's a marriage of those that comes together to really support us.
That's what attracted me to this space that I'm in today. I was a practicing family doctor for less than 2 years when I realized that it was pretty challenging to make a difference for my patients in a 15-minute HMO influence time slot. And that really getting to the root of the problem, the healthy habits, the positive emotions, wasn't feasible in that setting. And most of my adult patients were coming during the workday, going in and out. And it just dawned on me, Liana, hey, they're spending most of their hours at work. I should be there. And here I am.
And you are using all that experience, years of doing this, to, I understand, to put together some wonderful information in a book and a potential this training program. So that's really exciting, hot off the press. Tell us a little bit about that.
Oh, thank you. Yeah, it is hot off the press. Just recently, A Cure for the Common Company was released. I wrote it for a number of different reasons. One of the primary reasons was to help leaders and managers understand their role in supporting health and well-being in the workplace, including happiness. In fact, the subtitle is A Well-Being Prescription for a Happier, Healthier, and More Resilient Workforce. And I was very intentional. Oh, you can see the smiley faces too on the cover. I was very intentional to include happiness because, as you know, and many of your listeners, our emotions greatly influence our health and our healthy behaviors. Oh, you mentioned the training program too. Yeah, I'm excited that that is live. We have a training now based off of the book at creatingawellbeingculture.com for those professionals who want to learn more and build skills to actually deliver in the workplace. One of the fun things about the project, Liana, which was also a challenge, is to write it so that our colleagues in the healthcare space could also learn from it. And I do think for most healthcare providers, uh, getting the context of where we spend most of our waking hours, the workplace, into the discussion with our patients is something that's new. And hopefully, the resources I'm providing will not only help the providers, but also the interactions they have with their patients.
Well, thank you for that, because that was going to be my next question. Because you talked about how those first couple of years of practice, you felt you weren't doing enough. It wasn't impactful enough, and make this wonderful case about where a lot of the impact is where we spend most of our time, which is at work. But many of our health professionals, of course, are really committed to working in a medical practice, a lifestyle medicine practice, and they want to do the most that they can on with their patients, on the behalf of their patients. And so this is a new kind of conversation that we're having in this podcast about thinking about the workplace, talking about the workplace with your patients, as well as in the healthcare setting. Of course, we do want to, and the GPHI is promoting using the whole healthcare team to figure out how we can harness the best of healthy lifestyles, positive psychology, 24/7 for all of
Yeah,
us.
right. And there really is an opportunity for providers to take just a little portion of their time with the patients to pursue this area. Now, everyone's got a lot of things they want to cover during that 15 or 30-minute session. So I don't pretend like the whole thing is going to be focused on the workplace. But even two questions like, are there any coworkers that add to your happiness? And are there any that take away from it? And just to help your patients get some introspection about how the people they work with influence their well being could be a gift, because then they could take the next step and position themselves to spend more time with the happy coworkers and spend less time with the coworkers who stress them.
Yes, make an absolutely powerful case there. So thanks, Rich, and
Yeah.
hopefully we can spread that message.
Well, there's a whole chapter on peer support, and we can be intentional about how others help us or hurt us. And every one of the chapters, Liana, in the book, a clinician or a provider could convert to their experience with their patients.
And within this positive psychology sphere, we often talk about PERMA, are you permeating today, which increases our happiness and our health, positive emotions, engagement, relationships, meaning, and achievement, accomplishment. And out of all of those, relationships is the most robust. It's the most powerful. We have some amazing scientific studies, cohort studies, long-term studies that show that if you whittle down all the other confounding variables, if you will, it comes down to those connections. And so we want positive interactions and positive connections throughout our day. And of course, that includes the workspace.
Oh, absolutely. I don't know if you saw recently a study from a company called UKG in England, I believe, and they are in the software space, I think, for human resources. They did a global study, 3,000 employees, and they found that the percentage of employees who say that their mental health is influenced by their spouses is 69%. And this isn't a surprise. The percentage of these employees whose mental health is influenced by their manager is also 69%, which is remarkable in the sense that these, someone who you're married to for your entire life is having the same influence as the boss.
Very powerful, very powerful.
Yeah.
Um, So as we're going to be wrapping up here on this very short podcast, I do have a couple more questions. One is that if we succeed in doing what you and I and many colleagues are working to do, to really harness the best of healthy lifestyle, of positive psychology, of happiness, well-being, both at home and in the workplace, in healthcare, so that we emphasize this in healthcare. What would that future look like? What would we be doing? How would that turn out?
To optimize the probability that our patients would find happiness and health throughout the days, we many of your listeners are going to know this. We need to be holistic, and holistic is not just about the different pillars in lifestyle medicine. Holistic is about the experiences that our patients are going through. And one of the major experiences in our lives is our workplace. I really don't think that we've leveraged the power of where our patients spend most of their waking hours. And even though most of our healthcare workforce is seeing patients one person at a time, I also think there's some healthcare providers who have relationships with some employers. And so it may just be worth the extra time to go and meet with the representative from that company to have that conversation, because we're all going to be more effective if we work together than if we work alone.
Terrific. Totally agree. Totally agree. I also always love to ask, because sometimes we share our favorite books and resources, and something brand new pops up, and I'm always looking for the best books. You've certainly talked to us about your book, which I'm sure is premier in the space on health and well-being and workspace. Appreciate that. But what are some other really favorite resources of yours that you go to and you recommend for our listeners?
Well, interestingly enough, I do reference a lot of books in my book, as well as journal articles, because they're important, as you say. So, one book, I'll stick with the peer support theme. One book that will really convince your listeners how powerful the people next to us, the people 2 degrees from us, and even up to 3 degrees from us influence our behavior and emotions is a book called Connected by Nicholas Christakis and James Fowler. And it's probably at least a decade old. And yet the science is so overwhelmingly pointed in this direction. Any reader is going to be convinced that they need to include some conversation with their patients about who's around them, who's influencing their health and behavior.
That's one of my favorite books, that whole construct that people that we don't even personally know, their
Hmm.
contacts of our contacts can, there's a correlation there, somehow
Yeah.
influence us.
Yes.
It became sort of, it hit the news a while back. I think it was a New England Journal of Medicine article on obesity and people who are connected 3 degrees
Hmm.
to more obese people
Yeah.
tend to have a higher likelihood of being obese themselves. And but the same has been shown for a number of other constructs, including emotions and happiness,
Yeah.
as you
Yeah.
mentioned.
Yeah, it's pretty remarkable. I think they got a number of uh, New England Journal of Medicine articles, and ultimately with their, treasure trove of research combined with some others, they pulled together a nice book that kind of tells it all.
Yeah, another facet of this, the crux of our uh, social being. And as human beings, we're so social, and who we connect with directly and indirectly impacts everything about us.
Yeah, Liana, it's interesting as practitioners, I think most of us go through training focused on the individual, like what can your patient do for themselves and what can you do for the patient? And really this idea of, hey, let's practice holistic medicine, holistic care. We really have to think about where are our patients in their communities, in their social groups, in the workplace, which is my area. And of course, as you mentioned, A Cure for the Common Company is really designed to bring all of the different influencers together in one book so that readers can get a holistic approach of how the workplace influences our health and practical tips about how we can make it work for us instead of against our health.
Yes, yes, absolutely. So as we close, do you have any parting words? Like, what is one concept that you'd love people who are listening to walk away with after our chat here?
Oh boy, it's always hard for me to put things down into one concept. Um, Listen, some of your listeners are managers or you lead people, and even if you don't have people report to you, if you're in healthcare, there's a good chance that you lead by influence. And so, whether it's 6 people or an entire physician practice, if you're a leader or a manager, one thing you can do to help the people around you is just put well-being on the agenda. Make a space for it so that whenever you meet with your teams, whether it's once a month or once a week, when you see that you're reminded that, gee, I need to figure out what it is we're going to address today. Because it's not always directly about patient care, patient flow, patient safety. Underneath all those things is our own well being. And if we're not at our best, there's no way that we can deliver the best care. So put well being on the agenda. That would be my one takeaway.
Well said. Develop a culture of well-being.
Yeah, yep. And read the book.
Well, thank you. Well, thank you, Dr. Rich Saphir, for joining us for the GPHI podcast. And thank you to our listeners for joining us, and hope to see you on another one of these podcasts. And in the meantime, be happy, healthy, and safe. Take care, everyone. Bye-bye.